Before I jump straight into this, I just want to say if you are someone who has endometriosis or you think you have endometriosis, definitely give this video a watch. If I had a microphone and I could speak to every single woman at once, I would. But unfortunately that can't happen, so I'm going to do everything I can to communicate with you guys through this video camera, on YouTube, also on my Instagram. I've created an endometriosis page to help guide women navigate the right path for them. Hi everyone, welcome back to my channel. I know it's been a really long time since you've seen me and since I've uploaded, but I have a lot to talk about today. Back in April, I uploaded my endometriosis diagnosis story, which recently has been gaining some views, more than I expected. And I truly owe it to you guys to not only share where I'm at now, but talk about everything that I've learned since uploading that video. It's insane. At the time, I really didn't know anything. I opened up the video reading the definition of endometriosis off Google. According to Mayo Clinic, endometriosis is a disorder in which tissue that normally lines the uterus grows outside of the uterus. And it was the wrong definition. And that's okay, because you know what I've come to realize is that most women unfortunately get caught up in the wrong care. Most of us are probably in the wrong hands before we're in the right hands, meaning with the right doctor. Women do end up spending a lot of time trying to get rid of the problem, but unfortunately most doctors go about it the wrong way. Endometriosis is a very complicated disease, and unfortunately general care is not up to standard, and I'll get into that. And also, just a disclaimer, if I mention any sort of treatment, any sort of surgery, any sort of medication that you have taken, I am not attacking any single woman who deals with endometriosis every single day, who does what they have to do to get by. This is not an attack on you. I'm specifically speaking on the general care women receive and how poor it is and how we just simply need change. And the only way that there can be improved care in our healthcare system regarding endometriosis specifically is if we talk about it. So since that video, wow, where should I start? I actually do have surgery scheduled. Took a lot of work to get to where I am now, to find the right doctor, and I'm talking hours of appointments with multiple doctors. I was almost scheduled with a doctor in my state, and then he went on medical leave, and it was not a good situation, and we don't even know when he's coming back. So then it left me right back on the drawing board. Like, I had to start all over. And I'm now getting surgery from Dr. Nicholas Kangawasa in Atlanta, Georgia. So I do have to travel, but it's going to be worth it, and I'll tell you why. So why am I getting surgery out of state? Why can't I just find a doctor in my state? I'm sure you have all these questions. Long story short, general gynecologists do not treat endometriosis effectively. General gynecologists, and I'm meaning anyone who is a non-excision specialist, tend to do an ablation suppression method on all their patients. So you suspect you have endometriosis, you go to your gynecologist. This is what we think we have to do. I literally did the same thing. You go to your doctor. A lot of the times, unfortunately, women get pushed away. And then there's women who, okay, you do get a step further. Your doctor says, yeah, we can do laparoscopic surgery, see if you have endometriosis, and we'll take care of it. But here's the problem. Usually they'll do laparoscopic surgery to diagnose you. They may perform ablation on some of your endometriosis. Ablation is when they cauterize endometriosis off, burn the endometriosis off, and that has been proven to be so ineffective and just not even good for our bodies that I still cannot believe that there are doctors that still use this method. Then after your surgery, what they'll normally do is they'll tell you, you need a hormonal suppression. My doctor last time prescribed me within a 5-minute conversation after finding out I had stage 4 endometriosis from diagnostic laparoscopic surgery that I needed to be prescribed Zoladex, which is a form of Lupron, and it basically shuts off your ovaries and which stops the production of estrogen in your body. And he said that I needed to be on this for 6 months so that he could perform surgery. I know that I am not a doctor. I know that I'm not a surgeon. I know that I know nothing about, you know, medication. I can't break it down and I can't describe to you why this ingredient is bad for you or why it's good for you. But I knew that I did not need to shut off my ovaries. I think a lot of what motivated me was the fact that I do want to be a mom one day, and hearing that I had stage 4 endometriosis was already difficult enough, and on top of that, hear from my doctor that he insists I take this drug, which by the way is a chemotherapy level drug that they use for men with prostate cancer, to help stop the progression of endometriosis so that he can perform surgery on me. It didn't sit well with me. I thought, how do I know if my estrogen levels are ever going to go back to normal so that I can sustain a pregnancy one day? I had so many questions. And not to mention, when I went home and I Googled the side effects, I could not believe the long-term effects associated with this drug. And I advise you all, anytime a doctor prescribes you something that is a treatment or a medication for something you need, please go home and Google. Do your research, read scholarly articles on what this drug could potentially do to you. I'm not trying to scare you away from medications and such. I just want you to understand that you have the power to educate yourself and to research all these things to ultimately protect your life and the quality of your life. If you are someone who did decide to take Zoladex, a form of Lupron, any sort of hormonal therapy, I'm not shaming you. But what I am shaming is the doctor who only sat with me for 5 minutes and told me that I'm going on this drug without even asking me if that's what I wanted to do, without even giving me any other options. That is what I'm shaming, and I almost fell under that care. These hormonal therapies can help women who are in serious pain. And as we all know, a lot of women with endometriosis, they have to stop their life because of this pain. So it is up to a patient and their doctor what sort of treatment they want to take to help these symptoms. But bringing it back to my story, taking this drug would have made no sense. So I rejected the drug and I did my research. I thought there has to be other ways. Upon research, I found that basically shutting off your ovaries does not stop the production of endometriosis. Endometriosis creates its own estrogen. I actually found a Facebook group upon researching just other ways to treat endometriosis called Nancy's Nook. That saved my life, literally. All I can say right now is if you have endometriosis, you need to go add yourself to Nancy's Nook right now. And you can pretty much search up anything under their files regarding symptoms, treatments, doctors who will help you around the world too. This is a worldwide group. It'll change your life. It's basically a resource guide, so you are responsible for pretty much answering your own questions because they actually most likely do have an answer for your question all under their files. So I highly suggest adding yourself to there. After getting accepted to this Facebook page, I saw that there was a doctor who was holding sort of a seminar and you could ask him a question. And I clicked on the webpage and you could submit your question and he would later on answer it. So I had submitted this doctor, which happens to be my endometriosis doctor now. I would have never known. I would have went with him. And I asked him what he thinks about taking a hormonal therapy, and it was the answer I needed on what kind of doctor I need to seek now to help treat my endometriosis and to prove my bad feelings about this drug. I'll put it up here. He basically said that he doesn't use hormonal therapies in his practice because it actually can make endometriosis harder to see during surgery. So the whole point of surgery in endometriosis is to take it out, right? And a lot of doctors burn it off, which we already discussed is not a good way to treat the disease. It leaves endometriosis inside your body still. It does not take the endometriosis implant or lesions out completely. And he said that because it's stopping the production of estrogen in your body, which actually swells up the endometriosis, it makes it harder to see. That shocked me, because then I thought to myself, well, how are these doctors prescribing these hormonal therapies and then doing surgery? On top of already burning it off, if that's the method they use, there's no way they can see all of it. And there's probably some left in these women's bodies, which is so scary to think about. Also, through my research, I found that there are actually gynecologists out there who go through more extensive training to become excision specialists. And what that means is, instead of ablating the endometriosis off, they'll actually go in and cut the endometriosis out, making sure there is none left in your body. Excision surgery is the gold standard surgery / treatment for women with endometriosis. And this is very, very important for all women to know, so that when they seek a doctor or when they navigate their own disease, they can know truly what's gonna save time, what's gonna save money, what's gonna save their life. It could be as simple as me telling you through this YouTube video. It can be something you do on your own research. And that's why I talk about this. I talk about this all the time. I talk about it with people in my life who don't even have endometriosis, and I just want everyone to be cared for. So I don't know if I'm going all over the place with this video, but there's so much that the world needs to know, that women need to know about this disease, how to go about it, and how to get your life back. How to protect your fertility the best way you can. If you'd like to learn more, if you'd like to talk to me personally, please, please, please comment down below. The best way I would say to get a hold of me is to just message me on my endometriosis Instagram. I'll respond to you right away. I respond to DMs a lot every single day regarding this and women's concerns, and sometimes people just need a vent and they message me, and I'm just here to talk and help. So the same goes out to you guys. I wanted to make sure I reached my YouTube community to let, you know, the women on here know that I do this on my own time. It's just my passion right now. It's probably gonna be my passion for a while, just to make sure that no one is seriously left behind. I'm excited to bring you guys along with me on my journey for surgery this October. I'm going to be vlogging the whole process. I'm going to be making videos on what I'm going to pack. I'm going to be making videos just on anything that you guys want to see too, so make sure you let me know. Thank you guys for watching, and I will talk to you soon. Bye.